Like wireless, eh?
So I'm here with Professor Tom Calma, who's delivering the foundation lecture tonight at the Australasian College of Emergency Medicine's annual scientific meeting about closing the gap.
Yeah, well, that's one of the issues I'll be covering off on, but I suppose in the broadest terms it'll be about closing the gap, but also, there'll be some address to mental health and suicide prevention for all Australians, but with a bit of a bias towards Aboriginal and Torres Strait Islander people.
So where do you think we're at with closing the gap? You were one of the initiators, I suppose, of this. Yeah.
Look, I think it depends on how we measure it. In some ways we've still got a long way to go, but in other ways we've seen advancement. It gets a bit clouded because in 2008 the government indicated, well, they signed up to what we call a statement of intent, and they undertook to do a whole range of things, and it was also countersigned by the opposition at the time, and subsequently all states and territories have also signed statements of intent, and that's all about working with Aboriginal and Torres Strait Islander people on addressing health inequality and the social determinants around health, which is very important to look at. And we've seen a different set of, I guess, advancements. One of the things was that in the first round, the government unilaterally determined a whole range of targets, which is really not in the spirit of what we'd negotiated, but so be it. We've now had 10 years pass, and many of those targets haven't been reached. In part, that's understandable because when you're looking at health, a change to health status and population health particularly, that's something that will take some time. And when I wrote the report in 2005, I called for a generations target and level of activity. So 10 years is, and that's a bit of a misnomer as well, because whilst theoretically 10 years have passed, we've had so much changes to government policies that it's meant that there's been no consistency and level of engagement with Aboriginal and Torres Strait Islander people. At the 10-year anniversary, I in fact pointed out that at the time we'd had 4 different Prime Ministers. We've now had 5. We've had the same number of Ministers of Health and Ministers for Indigenous Affairs, but we've also had thousands of bureaucrats move through the system, and that causes a total inconsistency in policy approach. And the only consistency has been Aboriginal and Torres Strait Islander people who are still there, still working on the issues that impact on us. And it's taken some time, but we have seen some advancement. Like, there's been a very positive advancement in infant mortality, and that's down to significant part because of immunisation. But we've seen education, people completing year 12 and going on to higher education, which is another very positive move. We've seen massive reductions in real terms in smoking behaviours, and so that's very significant, and that's a real positive because in that 10-year period we then had appointed our first Minister for Indigenous Health, Minister Ken Wyatt, who was a very positive move because he's a person who had a lot of experience in Indigenous health before becoming a minister and really understood what was required and the approach to take and the need for consistent policy and consistent funding with not a lot of change in policy approach. And that's been, I guess, why we've now received 4 years of approval for funding starting this year and $184 million. And we will really make a dent in the smoking incidence of Aboriginal and Torres Strait Islander people because it's so important, because that's the single biggest contributor to chronic disease and early death of Aboriginal and Torres Strait Islander people.
So what are some of the barriers that are standing in the way? You touched on the bureaucracy and the...
Yeah, I think that's the most significant, and the stop-start of funding, the inconsistency in approach by the Commonwealth and the jurisdictions, the states and territories, because the whole closing the gap is a COAG initiative, and we should have equal participation or or fair participation by the states and territories as well as the federal government. A lot of the lifting's been left to the federal government, and that needs to change. And it's only since last year, I think December, that we had the government accept the My Life, My Lead report, which is an approach looking at the social determinants of health and cultural determinants, which is what we've been pushing for in my 2005 report. That was one of the hallmarks to say, we've had people like Sir Michael Marmot come over and talk about social determinants. We've been consistently trying to get the government engaged. Well, it's finally happened. Cabinet signed off on a report last December, so that's positive. Last November 2017, the Health Minister signed off on the Aboriginal and Torres Strait Islander social emotional wellbeing framework, which is also very positive. With both those and with the National Aboriginal and Torres Strait Islander Health Policy, we need to see funding come with that and a consistent policy approach. So that's where we're at. Just today, in fact, we've seen a big call by NACCHO, the National Aboriginal Community Controlled Health Organisations, and 13 peak bodies have got together and written to the First Ministers, all the Premiers and Chief Ministers and the Prime Minister, saying that, we want to be at the table, at the COAG table, when we're determining the new round of targets that are going to impact on Aboriginal and Torres Strait Islander people. At the moment, we're not in that process. We've invested a lot of time and effort as Aboriginal and Torres Strait Islander people in informing the government on the sort of targets and the priority areas that we see should happen. That's gone into bureaucracy, but feedback hasn't come back to us, and yet there's going to be a meeting with the COAG on the 12th of December, which will determine the future. So we don't have the confidence that ministers haven't interfered with what we see as the priority areas, and or negotiate with us, talk to us. Prime Minister Turnbull was very keen to pick up on the slogan, "Do it with us, not to us," and which is what we've been pushing for quite a while. And we need all ministers to recognise that, because governments can't make us healthy. We have to take control of that ourselves, and so it's all about empowerment and giving the direction and the support and confidence to people to address their health issues.
So what are some of those targets, or what are the things that should have been included in the original targets that perhaps weren't? Well,
we don't know what's in this next round of what's going up to COAG, but there's been a strong call, and we know that one of the targets that was heavily supported by Aboriginal and Torres Strait Islander people was a target on addressing disabilities, which is a very important and growing sector. We call for a justice target to say, we've got too many of our people in prisons, and when you do an analysis of why Aboriginal people are in prisons, you see that it's because of a lot of crimes which we might consider to be softer crimes. A lot are around, violence and assaults, some around burglary, but a lot of them are around issues that could be addressed beforehand. Many are related to traffic accidents and traffic incidents that gets people into jail, people not paying fines or not performing community service orders and the like. But what we argue, and this was an important one that was done last December, the Australian Law Reform Commission did a review into Indigenous incarceration, led by the only Aboriginal and Torres Strait Islander judge, Justice Matt Myers, and he led that process, and with the whole range of people involved in it, Indigenous and non-Indigenous, in the criminal justice area, and we come up with a whole range of sort of approaches that need to be taken. That was all tabled last December, 11th of December actually. Last year, we still haven't heard a single thing about it. Now, this was a report that was actually called for by the Attorney General of the day, George Brandis, who subsequently left. So this is where Aboriginal people, Torres Strait Islander people, get pretty pissed off, because we are continually investing. We keep on getting asked about, well, what do you need to do? How do we help you? And all this sort of stuff. We invest in this, and yet nothing gets heard. We have so many, joint House of Representatives or Senate committee reports that have been done, inquiries, that sit on the shelf. We've now got the ludicrous situation where the government's, appointed former Prime Minister Abbott to go out as a special envoy on Indigenous affairs to run around the country to again ask people, what do you want to happen? And all he needs to do is to look at the numerous reports that have been done on Aboriginal and Torres Strait Islander education and issues to address, attendance and so forth. And, those solutions have been offered up for years. So why, by the experts, people who are invested in this area. And so why have we got another waste of money that's going to be, debited against the Aboriginal expenditure portfolio on somebody who's going to run around the country, and whether they ever get to implement anything, we don't know. But unfortunately, I don't have the confidence that this will go anywhere other than just to keep, former Prime Minister Abbott out of Canberra whilst they get on and do their other business.
Where does Makarrata fit into all of this? And, obviously this has reared its head again with the talk of the Republic, and there's been quite a pushback against this from the Aboriginal activists in the community about this is the wrong time to be talking about having a Republic when we've got this very much more important debate that needs to be resolved.
Yeah, I haven't followed that Republic debate, but as far as Makarrata goes, I think there is definitely a need for a process that we can actually consider treaties, and that's what the Makarrata is about. It's about a mechanism to consider dispute resolution and to come up with some agreements, and what form that takes, will yet to be determined. I think that's the main thing. Where it comes from in Eastern Arnhem Land, Makarrata first was raised, and that's a process that they have for dispute resolution. Doesn't necessarily translate, to the letter at a national level. So we have to look at it, but I think the principle behind an entity to work through these issues is going to be an important one, as is, the voice to Parliament. But as yet we don't know what that voice may look like, and how it might operate, and so there's a fair bit of work, I believe, that needs to happen. And in fact, the current Social Justice Commissioner, June Oscar, and the former Social Justice Commissioners, myself, Mick Good and Mick Dodson and Bill Jonas, all put in a joint report to the joint committee looking at this issue, and we offered up a whole range of I guess the issues that we've covered over the last 25 or so years of social justice commissioners that need to be addressed. One of them is the voice, but that is one of a whole range of initiatives that need to happen, and what we've been saying, and Aboriginal Torres Strait Islander people have been saying, and they said it to the expert panel on constitutional reform, about issues like addressing the race clauses in the Constitution, making sure that there is non-discrimination in the Constitution, making sure that there is a recognition of Aboriginal and Torres Strait Islander people in the Constitution, which goes beyond just saying we need a voice, because the voice in itself, we don't know what authority that will have, and if it's like any of the other committees that are there, the advisory committees to government, their advice is often just put aside, and I think the key example of that was for the anti-intervention in 2007, that emergency legislation. The Human Rights Committee actually wrote to the legislators at the time saying that this contravenes our human rights, what Australia had signed up to, and yet that was totally dismissed, and sometime after the legislation got through, they presented a report to address the concerns of that committee. So it shows that even the most authoritative committees in Parliament that are sanctioned by the Parliament to address legislation on its progress through the system doesn't have to be heard. So that's an advisory committee, and I think we need something a little bit more powerful than that.
Trevor Pearce from Bacho wrote a piece last week saying that we can't close the gap in health without talking about and addressing racism. What's your views on that question?
No, it's a fact. Racism is a determinant of health, and it's a major determinant that we have to look at. For both mental health and physical health, it's something that's been addressed in the My Life, My Lead report, which was a big inquiry into social determinants. Racism came up as one of the key issues that need to be found. Victoria, Vic Health has done a major review down there that showed that a very high percentage of Aboriginal people had in fact experienced racism, and so I think that needs to be addressed. One of the issues I'll talk about tonight is that very point, and about unconscious bias, how people's views have been influenced by the mainstream media, and that's not necessarily always the best way to get advice. Yeah,
well, I was going to say, you're here tonight to talk to a room full of health practitioners, emergency doctors. What are your messages going to be about closing the gap and about the agenda in general?
I think, look, there's a number of things. Firstly, the college has got a RAP, a Reconciliation Action Plan, that in reading it looks very good. But I also note that it expires this year, so there must be a new iteration of that coming out. So I'll offer some observations on that RAP and what RAPs are able to achieve nationally. And as co-chair of Reconciliation Australia, we look at this business. We now have a barometer for Reconciliation barometer. We've done a RAP impact statement, so we can tell fairly precisely, the benefits of a RAP and how important they are. I'll talk about unconscious bias, a little bit about social and cultural determinants and how that's important to think about, and then touch a fair bit on mental health, because first responders often experience mental health challenges that others in the community don't. People under stressful situations, people are exposed to trauma, and this puts the emergency doctor and staff in the box position to be impacted. So I'll talk a little bit about some of the services that are offered through Beyond Blue and how effective they are, so that it may, even if it touches one person, I think that's job not done, but at least we're looking at that. I'll talk a bit about smoking, and and that's one of the real big positives, tackling Indigenous smoking in Indigenous health. A bit about suicide prevention, which is the other area I work on. So yeah.
Well, in fact, you're in Perth also for the suicide prevention conference. That's correct? Yeah.
Yeah. Well, there's two conferences actually.
Yep.
One is the second National Aboriginal and Torres Strait Islander Suicide Prevention Conference. In 2016, we held the first one in Alice Springs, and so we've got the second one happening now, and that backs onto the second World Indigenous Suicide Prevention Conference. The first one we held in 2016 as well in Rotorua, and so in 2 years' time we'll pass it on, and so I'm patron of both those conferences, and so have a role to play in that, and so it's a great opportunity. Today has been, and I haven't seen the outcomes because I'm here, but we got youth from Canada, New Zealand, Australia, all together to work through a whole range of programs. Some people will be at risk, others are there to be learning so that they don't get to be at risk, but working out how they can help others, a bit of an empowerment, a bit of exposure, cultural exposure sort of opportunity. And so that's a great one today, and the Canadian government supported a number of their delegates to come over, which was good. And at the conference for the next 4 days, we'll have the Canadian High Commissioner to Australia, His Excellency Paul Madden, joining us. And so he's been a strong supporter, as is his wife, in mental health and suicide prevention, and particularly around trauma. And I'll touch on trauma tomorrow, because that's one of the things that, if we just judge people by their behaviour without understanding why they might be behaving in the way they are, it can often be very misleading. And I've got a number of examples that I'll show at this conference, emergency doctors, but I'll also talk about that at the next conference over the next couple of days as well. But yeah, we've got a great delegation of internationals, from mainly Canada, the US, and New Zealand here with Aboriginal Torres Strait Islander people. It's quite, and it shows the sort of why these conferences are so important. We thought we'd get 350 people. We sort of thought we'd be really happy if we got 370. We had to lock the door at 530, and there's still people knocking. But and it's one of the sad things is that there is a big interest in this area, and we need governments to understand that they have to work to support some of these initiatives. Australia as a nation, we've crossed the 3,000 deaths a year by suicide, and Aboriginal Torres Strait Islander are only a small proportion of that. But as a nation, over 3,000, this has been each year accumulating, so it doesn't matter what effort we put in, and yet we get, not even half that number of people killed on our roads, and the government invests billions into the black spot road programs, and yet they put thousands into suicide prevention. There's these sort of issues that we have to look at, and governments need to be aware of.
It's a really important time to be working in this space, it sounds like, and a lot of, like you say, opportunities and potential.
Yeah, well, there's a lot of people, and we've got Professor Pat Dudgeon here at the Poach Centre at UniWA, who runs the National Best Practice Centre for Suicide Prevention, which is just emerging as a really important role. That's federally funded, which is good, but that's only got a couple of years of support. These are investments we need to do over 10 years, over 20 years, as I call for a generational investment, and that's what we need. And it'd be very interesting to see how much money is going to start to flow towards cricket now that we're not winning, or rugby. We're not the premier sport in the globe, and we saw that with I think it was Montreal Olympics, and that's the example I used with the Close the Gap. If to win gold medals, we'll invest big time. To save people's lives, we do a token effort. But yeah,
there's work to be done.
Yes.